Hello, and welcome to Black Men's Health, where today we are with Dr. Jarrod Carrol, a proud alum of Florida A&M University and the Howard University School of Medicine. He is currently a geriatrician for Kaiser Permanente in Los Angeles. Is that correct?
That is correct. That is
All
correct.
right. And we are happy to have Dr. Carrol on to talk about Black men and healthy aging.
Mhm. Definitely, definitely. It's a pleasure being here today. So thank you, John. Thank you, Tacoma, for having me. As Tacoma mentioned, I am a geriatrician, meaning that I focus on the care and needs of patients, generally speaking, over the age of 65. It's not really a cutoff, but just the aging population in general. And my primary role now is working in the memory evaluation clinic, but I still do a lot of general geriatric topics as well.
Grateful to have you, brother.
Mhm.
FAMU and Howard, touched them all, huh?
Definitely, definitely. Never forget where you came from.
Amen.
Absolutely. And speaking of which, I think we should open the conversation. We like to do an icebreaker. And I remember a long time ago in a galaxy far away, back when I was a young journalist in Nashville, Tennessee, there was this thing called Match Day at Meharry Medical School. Um, and it was just an awesome experience to be there as the graduates are learning where they will be working, after leaving medical school. One, was there such a thing like that at Howard? And two, what was that experience like if that was something you guys had?
Yeah, it's definitely something that every medical school is involved and engaged in. It's a culmination of years of hard work, years not of hard work for you, but prayers and standing on the shoulders of giants that came before you. And so we did have ours there at Howard, and I found out that I had successfully matched to Wake Forest in North Carolina for internal medicine residency. So it means a lot. It's match day because essentially you choose them and they choose you. So it has to be a match. And so it worked out just like I had planned it would. And so God was definitely on my side as he's always been.
Absolutely, absolutely. Yeah, I just remember it being an amazing experience. And we used to joke in the newsroom, like, this is a great way to find a mate, about to go to, be a resident, hey,
Right, right. So you finally can
our
start,
match day.
finally using the doctor word, the doctor term, routinely. Before it was kind of like student doctor, play doctor, but now it's like, no, you can address me as doctor. But yeah, so yeah, it was definitely a good experience back in it. And believe it or not, match day, I think actually was this past week. So I actually matched 10 years ago.
Wow. Okay, that's awesome.
Happy anniversary, Dr. Carrol.
Thank you,
Yes.
thank you, thank you.
Yes. So we like to start with, your childhood. Can you describe what it was like growing up, where you were? Who were some of the influences in your life when you were a child?
Okay, so I would definitely, so I'm originally from Jacksonville, Florida, which is about 2 hours from Tallahassee, where I went to undergrad. And so I grew up in a house full of love. So both my parents, my mother and father, Joe and Judy Carroll, made sure that each of my siblings and I had the support that we need, and not only the support within that house, but we had many houses throughout the city that the individuals there would pour into us. I always tell people, God gave me so much more when it came to the elderly population, because I grew up with 5 grandparents. So I grew up with 3 grandfathers and 2 grandmothers. So one additional one full of love. So another set of arms to take care of me and my siblings as we grew. And so each step along the way, I knew I could lean and depend on them. And I think that my experience growing up really impacted my career goals, because I was able to see my aging family, not only in my parents, but also in my grandparents. And so seeing them change over time impacted me, and it piqued my interest in what could I do, what could I contribute to try to help the aging population. And so I think leaving Jacksonville, going over to Florida A&M for undergrad, I left with that as my goal. I didn't exactly know what I would do in the field, but I knew that I wanted to work not only with the elderly, but their families as well. And so that's what I'm doing every day.
Okay, absolutely.
Dr. Carrol, you referenced something in a previous discussion that we were able to have offline, you, Takuma, and I, related to, you know, your order with your siblings, being that you have an older sister, you have an older brother, and yourself, which I know all of them. Blessed to get a chance to meet you as a very, very young man. So we're very proud of Dr. Carrol. But you said something that was so impactful that I hadn't thought of, in the sense of the birth order definitely is, you know, very impactful, especially in your area, because your experience could be very different than your sisters and your brothers based on, you know, where you are in the order, and how old your parents or your grandparents might be as you come up, and even your memory of them.
So definitely, I would say there is so much truth in birth order, not to the point that it should impact your every decision in life, like, oh, I'm not the firstborn, so I can't do this. But I think that there is some truth in birth order and the spacing of kids. So my brother is a little more than 8 years older than me, and my sister is a little more than 10 years older than me. And as a result, there was that space there where their experience with not only my parents, but also my grandparents was generally, I would say, different than mine. There may be some debate there, because they may basically say the reason, the major difference is I was spoiled. So I don't look at it like that, but I look at it that when my siblings left to go off to college, my grandparents were still sort of young and spry, and actually still working, I think, still working, you know, jobs. Whereas when I left to go to college, and being in middle school and high school, I was there during the retirement years, which is a very, very pivotal transition for any aging person. Because often, you know, we look forward to retiring. I can't wait to retire. I don't want to have to go to work for the man every day. But if we don't realize the impact that that transition can have, you know, we hope it's going to be positive, but actually could be negative if we don't feel that space that job occupied up with something else. So if we just sit around and don't use it, you know, if you don't use it, you lose it, that whole concept, there is some truth to that, because you have to fill that space, that void that the job left. We don't realize the role that a job plays in organizing and providing structure to our day. We sometimes are aggravated with it, but the job will actually tell you when you need to go to bed at night, when you need to wake up, and depending on the type of job you have, when you go to the bathroom, when you take your breaks and things like that. So it provides so much structure. So if we don't have that structure all of a sudden because we retired and we don't replace it, that in itself can impact us. So I was there with my grandparents when they went through those transitions. For the most part, they were generally good transitions, but we also started to see more focus on their health. Not that they retired because of health challenges, but as they got older, there were more doctor's appointments and things that need to be completed. And I became more involved and really interested in learning more about what was going on with my grandparents.
And speaking of which, I mean, because I think when we had our previous conversation for the article, you had talked about, you know, the lived experience of seeing your grandparents get older and how that influenced your career decision. Can you talk about also your intellectual interests, how they developed when you got to FAMU, and when that medical school decision started to come into play for you?
So great. So as I mentioned, so when I was going to undergrad, I was interested in working with the elderly population. That's all I knew. In fact, I want to say I didn't even know that there was a type of position called a geriatrician or geriatrics. I just wanted to work with old people, you know? And so when I initially got to FAMU, I actually was in a pre-physical therapy program because what I knew about the elderly population was they could get sick, they could have strokes, they could have heart attacks. And so I said, those are the people that will be of most need at that point. And so I wanted to be a physical therapist. I wanted to work in a rehab facility. But during that process, and everything happens for a reason, so you have to realize that. So during my first year, there was this huge announcement nationally that all physical therapy programs were transitioning from a master's program to doctoral. So it was going to be a longer program. And so when I'm sitting there, I'm like, so now I'm about to be in a doctoral program. Well, I might as well just go to medical school. You know, because I was here, I was going to get this master's in physical therapy. I was going to be a physical therapist. I was going to be happy, still be able to kick it with John in the Tacoma and talk about, you know, just taking care of the elderly. But I wanted to, I was like, I still wanted more. Not that I could not impact lives from a physical therapy standpoint. I partner with physical therapists a lot now and taking care of patients. But I became more interested in what else could I do? What other members of the team could I be on? What other roles on the team could I play in order to help the patients? And so I became interested in becoming a geriatrician. So that's when I first learned about geriatrics. And since then, that was all she wrote.
Mm-hmm. Absolutely. I guess we can come out and ask because I have an idea of what you're going to say, but right now, as it stands, on March 16, 2022, what is the state of Black aging in the United States right now?
So I definitely think this is a much needed conversation because aging in general, even the words that we use when we're describing the aging population can somewhat be seen as negative. So when you think of getting older, you think of senile, you think of a person being old. And I often have to tell patients and their families, we should just say that we're getting older, not that we're old, because that's an important difference, because older comments on the journey that you're going through. Old is like definitive, it's definite, like boom, Jarrod is old. And we always correlate that word with negative things like being feeble or falling or not being able to be independent or being dependent on our family around us. And so if we don't have these conversations early and often, then we will continue to have that same conversation about, oh, Jarrod just got old, or my grandmother is old, or my grandfather is old. So then we approach it like, oh, they're going to need all of our help. But if we start the conversation early and we say, Jarrod is getting older. So as Jarrod is getting older, as my grandfather is getting older, there are important conversations that we need to have. And that's the key in using certain terms. It's a conversation. It's not one time we talk about it, that's it. This is something that changes over time. Our choices in life will change over time. What we would want to be done will change over time. And we have to have these conversations not only with our family members, but also with our physicians, because that's a part of your care team. And what I would say about the state of Black aging, we know that the data supports that our life expectancy is shorter. There can be a lot of reasons that can there can be a lot of reasons that can explain that. But the key here, I think, is healthy living and healthy choices. And the importance of taking responsibility for ourselves. No doubt there are some psychosocial factors or other barriers that are outside of our control that are in place that may put us at a disadvantage or disproportionately impact us. But we do play a role in our own health as well. And we have to equip ourselves with the needed tools and knowledge in order to be able to take care of ourselves and our families.
Absolutely. And yes.
I was just about to say that. I like that in the sense of older, not old, right? In certain cultures, in certain communities, old is a blessing. Old is good, right? I mean, I just I just listened to something recently, and somebody was talking about, you know, a grandmother at 92, 96, something, and like that life didn't cheat them, right? Because that's a blessed opportunity for somebody to live that long. So a lot of times, you know, in certain cultures, certain communities, that those elders, that aging comes with wisdom and lived experiences, which are blessings. But I like that terminology in the sense of older. And we realize as we grow, if we're blessed to have parents that are getting older, again, seeing those, as you said, Jarrod, Dr. Carrol, seeing those, you know, things change, seeing those benchmarks move, you know, and when I say benchmarks, being able to say, oh yeah, my dad's getting older or my mom's getting older, and realizing that's happening, these life changes are happening as we do also, especially when you have a reference and a framework that's the same, right? If you just like a child, if you take a child on the couch, or take a child at grandparents' house, every time they go to the door, you know, you have a reference of how tall they're getting or something of that nature. Same thing with your parents. Yeah.
Okay.
You know, you mentioned something earlier, and, you know, acknowledging what John said about, you know, when you get older, it's an ongoing conversation. It's an ongoing continuum of care that you have to undergo. But just for people who may be wondering what healthy aging is exactly, can you define that for me?
So I would say healthy aging in general is somewhat of a mindset, but there's a way we can describe it as well. So technically, when we look at the word health, health means free from disease. So as we get older, and when you ask people what do they think is healthy living or what do they think is healthy aging, our concept of what healthy is as we get older will change, because we somewhat acknowledge that we will have some changes, some diseases. The most common ailment that the elderly population has is arthritis. You know, everybody got a little arthritis, right? And so we accept there will be some changes. And so when we think of healthy living, it's more so trying to maintain a certain level of independence. It's more so trying to keep the vigor that kind of pushes you forward, because we have a lot of vigor as we grow, but when we get older, it seems to dissipate for a variety of reasons. You know, physical function will dissipate as well, and that's sort of why I like to talk about it in terms of getting older. You might can't run a mile, but you can walk a half a mile. So, you know, so you accepting those changes. So just seeing where you are now, staying in contact with your doctor, making sure that you are trying to identify and manage conditions. The issue is often when we wait too late to identify and it's too late to manage, then we have all these complications. So we need to have these conversations and an open conversation early and often, checking in with your doctor. That's a key component of healthy aging. That's a key component of healthy living. Being honest with your doctor, being honest with yourself is a key component of healthy living and healthy aging. The importance of diet, exercise, sleep, engagement, all of that is all parts of healthy living as we try to find a balance, a new balance. The balance will change over time. Your roles and your responsibilities will change over time. And so just trying to find what works with you and adjusting your diet, adjusting your exercise to meet the needs of your changing health goals.
Akuma, there's a thread that we keep hearing related to one, checking in, right? Very vital. But also the timing, right? The sooner than later, right? That thread, no matter if we're talking about heart health or diabetes or dental health, whatever it is, or oral health, oral care, that thread about just doing it sooner and having that relationship on that journey, you know, that medical journey, that physician, that medical expertise and experience, having that in your life sooner and being able to check in, that thread continues. We continue to hear that.
And I also want to comment, and I don't want this this conversation, this is a conversation we're having too. I don't want you guys to think I'm saying, you know, it's the patient's responsibility. They have to bring everything to us. we have some ownership as physicians as well. I pride myself in working in a very diverse setting. So I can see people that look like me. I can see people that likely had similar experiences growing up that I did, and I can appear to, relate to them. And it is incumbent upon us as providers, when the person is checking in, to bring up those hard questions, to have those hard discussions as well, because they need to know that we care about them. Because, there's a lot of data that also supports that, the timing of, the clinic visits are so quick, 15, 20 minutes. We spent the majority of time talking about this. I didn't get a chance to get to this. And so, we want you guys we want the physicians, the patients to come to the clinic, but we also have to make sure we're prioritizing things, because if we don't check for certain things, then you will never know. So we do want you to tell us what's going on, but we have to talk to you about what the age appropriate screening things are. We have to talk to you about preventative health. We have to talk to you about immunizations, vaccines, things of that nature. So that is what we have to do to keep you healthy as well. So it's a conversation, it's an agreement, it's a bond that you should have with your primary care physician. Yes, I do think that ideally even the data supports that people do better if they have a primary care physician that they can relate to. You can say they relate to for a variety of reasons, whether they're from the same place geographically, they look like that person, they're the same sex, the same age group, but whatever it is that draws you to that person, make sure that you have that connection so that conversation can commence and continue to occur.
Boom. So right there, that engagement with the doctor. Can you go into the other tips? Like, say I'm Takuma at 29 years old, or Malcolm at 49, or Bradley at 34. What advice would you have for us, and why should we care? Because, healthy aging, that's way down the road. I don't have to worry about that. So why should we care? And what can we do now to at least have a shot at healthy aging?
Okay, so I rarely see younger patients. I do see some younger patients, but just by the nature of what I do every day. But what I can say is the two things that I worry about in the younger population. So, patients in their 20s, patients in their 30s, sometimes patients in their teens, particularly in America, is we are still stuck in that I don't have to worry about that until I get older. But when you look at that same population, some of their comorbidities, some of their medical conditions are undiagnosed, and we just think it's normal. So we're not talking about obesity. We're saying, my grandfather's big, or my mom has diabetes, or I think she has pressure, or just using terms that I may hear, or she has high cholesterol, but I'm good. I'm still 21, I'm still 22, I'm still kicking it. I'm playing basketball with the boys, I'm doing all this, but we're not saying, let's look at your weight. Let's measure your blood pressure, because blood pressure is a silent killer.
Yeah.
So you don't feel it. Now, you may feel it if it's really, really high, but you may just write that off as it's just a regular headache. Or these morning headaches that you're having, you may say, I'm 21 years old. What's the deal? I should be fine. But that goes back to the checking in. And if nothing else, getting that routine physical evaluation. Does it have to be every year? That's what we recommend. But when you're in your 20s, I personally still want you going, once a year, but if you can do once every 2 years, once every 3 years, something where you can check in and get the roadmap as you continue to grow older. So it goes back to what I was saying. We're all getting older, but for so long, we've always said old, like, my grandmother is old, but we're all aging. This is a process. And so we have to plug in. Of course, as you get older, your appointments may become a little more frequent, but preventative health is key, even in the 20s. Don't want to open up Pandora's box, but getting vaccines, that's important in the 20s, because we know, just thinking about what just happened, with
Yep, yep.
Omicron and Delta, the
Yep.
major people that the spreaders were the teenagers and in their 20s, and they were taking it home to grandmother. Okay, so yes, they were healthy because their body could fight it off. They hadn't experienced the detrimental effects that can occur with your immune system sort of being weakened by aging. But the fact is, they have been impacted as well. And some of those same 20-year-olds, 30-year-olds had a lot of the same conditions and comorbidities that we're fighting in the elderly population, but no one's talking to them about it because it's normal that he's a little big, or normal that she's, you know, she is big. So those are conversations we have to have.
I love that reminder too, just about the annual check-in, in the sense of starting younger creates this pattern, right? And consistency for the future, where it's not abnormal. Like, it's just normal. This is and Takuma and I have talked about this with other you know, guests and panelists, Dr. Carrol, just related to, you know, sometimes with women, there's a reason, kind of the medical structure around them supports them having annual or more frequent visits. Whereas in men, if you don't kind of, you know, create some consistency, you could go for gaps of time without having, you know, that check-in. And we know we need to have that check-in. So that's good, starting younger. Even though when you're, like you said, kind of spry and young and, you know, all this bravado, it's good to make sure that we can check in and make sure that everything's ticking as it should be. Definitely.
And I would actually say that the healthcare community, while we still have a long way to go, there have been some strides in trying to utilize commonly, you know, frequently visited locations or places for the African American male. Back in 2006, yes, 2006, I was actually working down in Tampa at the cancer center there, Moffitt Cancer Center. And I was involved with a barbershop protocol, where we were going into barbershops talking about prostate cancer, something that disproportionately impacts African Americans, and the importance of having that conversation, talking about prostate cancer, talking about other things, you know. And I know there are a lot of pilot programs out now using that same concept of the barbershop for blood pressure, or barbershop for talking about diabetes, because we want it to be as comfortable as possible. Yes, you know, everything can't be done in the barbershop, but if we go there, hopefully we're able to express our interests, that we're intrinsically interested in your overall health, and hopefully that will bring you to the setting in which we can truly help you.
We've had some partnerships related to mental health with barbershops and barbers and coaches and trainers and, you know, these community liaisons, community gatekeepers. They don't have to be professionals, but clearly they have their own relationships, just like you said, Dr. Carrol, in the sense of somebody might come to you because, you know, of age or race or gender or whatever it is, they might feel more comfortable. Clearly, somebody like a barber, especially in my household, you know, these young men have their relationship with their barber, you know, for life, right? I mean, that has been the case with my young men, and the same thing for me. I've had, you know, some very long relationships with barbers where they can see changes along the way. So mental health, that has been continually, but the same thing, it could be with weight gain and everything else, right, Jarrod? If your barber's kind of watching you gain weight, especially like, whoa, what's going on here? You good? You know, things of that nature, or how you feeling, or something's off, or you have a new device on. What's that? What's going on with you, and things of that nature. So
exactly.
Yeah.
And in that setting, it's always been a haven and almost like a safety net for the African American male. And so it gives us an opportunity to kind of be ourselves and talk about the stresses. Oh, you know, I don't like that job, or, you know, she did this to me and I can't believe, you know, all this kind of stuff. So while we're already opening up, that can comment on stressors that could be impacting our health. So we can try to tie that all together. That's key. Okay.
Dr. Carrol, you also, speaking about the African American community and the African American male, and we just talked about the, some of the locker room-ish, environments like the barber shop. In an earlier discussion with yourself, Takuma, and I expressed, I thought that we were really going to be talking about aging in the sense of ourselves and men aging, but also when we start having this discussion about parents and watching, not only men that are aging, but also we're having elders that are also aging, and that's a lot of dynamic there. Just share, I mean, some of this gold that you shared with us, just related to, what your thoughts are related to men dealing with their own aging and own realities, and especially, with some of the things related to men in general in the African-American community, Black men, but also men that are potentially dealing with aging parents. Just want your, feedback and take on that.
Right. So I think a lot of it goes back to acceptance. And so I think it's a two-way street there. So sometimes, so if you think of the aging father and the aging son, regardless of how close they are, sometimes the aging father doesn't really accept that they're aging yet, because they always want to, that sort of bravado is still there. It's still there, although physically we may be slowing down. So the aging father may not be as open and honest with the aging son about what is changing, for fear. The aging son may notice certain things in the aging father, but for whatever reason, how they were raised, the household they were brought up, they may not feel as comfortable talking to their aging father about it. They may talk to their aging mother, like, Mom, this is kind of what's going on with Dad. Have you seen this? And I see this all the time in the clinic. So I'll see that kind of relationship dynamic. And then taking a step farther, actually, John, so when you're talking about your dad, or you're talking about an important man in your life, you also have to keep in mind, well, what image am I portraying to my son? Because this can be him one day. So I always tell people the psychology of it is key, because you think, okay, I need to do this for Dad. And so it's very reflexive for the woman, and I'm speaking stereotypically. I don't want anybody to think that women and men are one set thing, but it's very reflexive for the woman to say, okay, I need to go to the house and start helping Mom and Dad. It's not as reflexive for the man to do that. And I personally think it's reflexive for the woman to do that, because they also know the daughter and son is watching them. So they want to pass that down, like, this is kind of what you're supposed to do. We don't see that same behavior with the son helping his dad. We sort of say, oh, I have a sister, she can help, or maybe my wife can help, or something like that. And I can't explain why, but that's just sort of where we are. And I do think there's a lot of psychology behind it, particularly, let's say one of the taboos in our community is placement, putting people in facilities, or putting them in old folks' homes, or putting them away. We don't use that term or that phrase anymore. Often I see people struggling with it, men and women, struggling with it. When I get to the meat of it, a lot of it is, some of it's finances, but a lot of it could be, I don't want my kids to put me in a home. So I don't want them to see Dad and grandmom and granddad going into a home. So we just go struggle it out. And I see the entire family suffer, because we're afraid of what could happen to us. Somewhat selfish, but it's real. It's real.
Deep. That's deep.
It's real.
You're talking about the actions of you for your parents, and whether it be consciously or subconsciously considering what that means for the setup for you.
Exactly, because these are the same people that have told their kids, don't put me in a home. Mm-hmm. Don't put me in a home. I'm staying in this house right here. And so when they're posed with those difficult conversations and difficult discussions, they shy away from them, because they're thinking about, if this was me, what I would want. No doubt, we want a mom and dad to be with us for for in the house forever, right? We want that. But when our care needs exceed that which can be provided, we got to think of something else. We have to. So just kind of around with that.
Yeah, that's wow. Yeah, that's that's hitting home for me, I know personally. But I also wanted to go back to a conversation we had previously, that I think is apropos given what John has brought up about mental health. And so I wanted to ask you, how important is addressing the mental health aspect, particularly past traumas, when it comes to that conversation about healthy aging?
Okay, that also goes back to acknowledgement. I'm sorry, let me drink some water. As you see that. Okay, I'm just
Representing.
Always.
sure. It's always right here by me. It's always right by me. So what do we see? What do we see as far as mental health? So first, we have to acknowledge. We have to acknowledge our past traumas. We have to be willing to talk about it. We have to be able to think about therapy. You know, therapy that was taboo. Therapy is probably one of the biggest taboos in the Black community, let's be honest. You know, Black men say they don't want to go to therapy. Women are slowly going to therapy more. And I think men are starting to do a little bit more too. But I think a lot of that stems from the fact that we grew up in the mindset that we have the weight of the world on our shoulders. And that's passed down from generation to generation. So we expect, you know what, I got to do this, and I just got to be able to handle it. And so if we internalize that trauma, we internalize all of that extra baggage that we're having, we internalize what happened to us as a child. It could be abuse, physical, sexual, emotional. We internalize that, and often we hope that drives us to excel and do better. But if we don't acknowledge the scar that's there, the emptiness that's there, that we don't acknowledge that we need help because of it, then we run the risk of a long-term decline and a decrease in our overall ability to succeed. I'm not saying that people that have experienced traumas can't be successful. Okay, I'm not saying that at all. They definitely can overcome what's going on. But what I'm saying is, I would be concerned that they may not reach their full potential if they don't acknowledge the traumas that exist. Additionally, if you say something, it could help someone else. Okay, so if you say, this is what I've been through, this is what I've gone through, this is what I'm going through, it may connect with someone else on the other side of that phone, that what you use to cope, but often we cope by covering. So what you use to cope is key to share those things, because it may help someone else, and it may allow you, if you feel that void that was there, by acknowledging what happened and talking about that trauma, you can fill it up with something else that's more positive, that you truly can continue to excel. Again, I'm not saying that people with trauma can't excel, but I think that there's a risk that they're not able to reach their full potential if they don't address those past traumas. Now, to comment on another comment on mental health, things like undiagnosed mental health issues. We have some in every family. We all have that cousin that's a little off that no one wants to talk about, or things like that. So we must try to get that person the help that they need. Okay, encouraging them, trying to support them as much as possible so that they can be their best person. Because what happens is, if we don't try to plug them into the resources, we don't try to get them the help, then that person could potentially drain the family. And I'm not talking about financially. I'm just saying it could just drain it with the stressors of still dealing with what they're going through. If we've never said, this person actually might have bipolar disorder, this person might actually have schizophrenia. Stop saying the person crazy. Oh, she crazy. Or she don't went crazy. She done lost her mind. We have to acknowledge what it is, so that we can try to help them, because helping them may actually help us.
Dr. Carrol, I know we said that we would keep it brief for you, and I know you have some other things to do, but we are definitely going to have to get back to this discussion, if only, Takuma, for just some question and answers, maybe some, asking me anything to Dr. Jarrod Carrol, because I'm sure a lot of people in the community have a lot of questions about whether it be their own aging or aging parents or loved ones. So I'm grateful. I'm gonna let Takuma close it out. I promise you, as I always joke, because he's so prepared, he has 82 more questions. So we're gonna have to circle back to this. And I know there's also some more that'll be out related to an article on blackmanshealth.com also.
Yeah.
Absolutely. And we just like to close with, is there anything else you'd like to add?
I want to keep it full circle. So I'm encouraging everyone out there to check in. That's all I want to say. Check in, as we check in with our friends, as we check in with our family, check in with the doctor. Plug in to see where you are at this point. Take your pulse of where you are right now. We all have a pulse. So check your pulse right now. That meaning, and I'm not saying physically check it, but check your pulse of where your health is, your health pulse. And so you can see where you are now, so that in the future, if things change, you have something to compare it to. This is where I was as far as weight. This is where I was as far as cholesterol. This is where I was as far as blood pressure. Oh, I have a family history of breast cancer, or I have a family history of prostate cancer. Let's talk about those things, okay? We can't wait until we're 50. We can't wait until we're 60 to have these conversations, because older is coming. We're older each day, okay? So take care of yourself, check in. We're here to help, okay?
As the kids say, on that note, mic drop, right?
Mic drop, right. Check in. So it's been a pleasure talking to you guys. I do have to step away for another meeting, but definitely let me know what we can do to help. We're here to help. We're all in this together. Keep that in mind.
We appreciate you, Dr. Carrol. Grateful for your time and attention, sir. We'll do it again.
All right, definitely. Take care. Be safe.
You all too. Respect.